Aortic dissection. I'm sure by now that you've heard those words. Now, most people will tell you by the time you have it, there's not much we can do. That's actually not true for everyone. Now, if we can diagnose you early and treat you, you have an 85% chance of survival. However, 3 out of every 4 people who get aortic dissection actually have had this one clue for over a decade. And that has to do with your blood pressure. Now, the vast majority of people who have high blood pressure will never develop an aortic dissection. And there are actually different types. So let's not get paranoid. But most people who have aortic dissections will have at least one measurement in their blood pressure indicating that they have had stage 3 hypertension within the last 5 years. But significant risk factors actually start a lot lower than stage 3 hypertension. By the way, my name is Dr. Liu, and I'm a double-boarded physician practicing for 25 plus years. I've seen quite a few cases of aortic dissection because sometimes they get complications or an infectious disease causes their dissection. So in this video, I'm going to share with you the different type of aortic dissection and how lowering your blood pressure number can significantly lower your risk. And most importantly, I'm going to share with you the warning signs that you should just never ignore. Now, I want you first to feel the top of your sternum and then walk your fingers down to the left side of your chest and count your ribs, 1, 2, and 3 with your fingers. So this is where your aortic root is, right around here. But you can't really feel it pulsating because it lays deep within the center of your chest behind this bone, this big bone, the sternum. But if you lay down and you bend your knees and you press your fingers in your abdomen on top of your belly button, you will actually feel a rhythmic pulsation that should measure less than 2.5 centimeters. And that is your abdominal aorta. Now on physical exam, if that pulsation is wider than 2.5 centimeters, then your doctor may be suspicious of a dilated abdominal aorta. That can increase your risk of getting an aortic dissection. So there are 2 types of aortic dissection. The first one is called type A. That involves the ascending aorta. And the second one is type B, and that doesn't involve the ascending aorta. Now, the aorta is the largest and strongest blood vessel that you have in your body. And it has a big job. Its job is to bring blood from your heart to the rest of your body. Now, unfortunately, most of the time, people who present with aortic dissection have an acute aortic syndrome. And that's either caused by blood tearing through the wall and splitting the wall in half, kind of like taking out tape from the floor, or an aortic plaque that basically grinds through the aortic wall and causes an ulcer, and then that causes a bleed. So if you're Asian, you have a higher risk of type A aortic dissection, the first syndrome, where there is a tear in your abdominal wall causing a bleed. And if you're elderly, you have a higher risk of getting type B aortic dissection, a plaque causing an ulcer that chews through your aortic wall. And these dissections can happen over 3 months or less than 24 hours. Now, most dissections are type A dissections, which is an emergency and requires open surgery to repair the dissection. And you have a 57% chance of survival. Now, if you have a type B dissection, the plaque dissection, people may just observe you and optimize your medical therapy. And you actually have a 90% chance of survival, unless you get complications. Now, the most important factor to control when you have an aortic dissection is to lower your blood pressure. But by the time that you're at that stage, your doctor, they'll know what to do. Now, before you get to that emergent stage, what can you do at home to prevent yourself from getting a dissection? Lower your blood pressure. People who are at risk of having aortic dissection, well, for every 5 millimeters of mercury that you drop your systolic blood pressure, that can reduce your risk of having a fatal cardiovascular event by 12%. If you reduce it by 10 millimeters of mercury, you can lower your risk by 23%. And if you reduce it by 20 millimeters of mercury, you can lower your risk by 40%. And then if you keep that up, basically beautiful blood pressure control for the next 1 to 3 years, you can actually improve the integrity of your aorta. So if you already have been told you have an aortic dissection, the goal would be to get your blood pressure down to less than 130/80. And if you've been following my videos, you know that a blood pressure of 130/80 is not a normal blood pressure. But when it comes to aortic dissections, a number less than 130/80 significantly reduces your risk. Now, between the top number, the systolic number, and the bottom number, the diastolic number, a higher bottom number, the diastolic number, carries a greater risk of having an acute aortic dissection. So if your diastolic blood pressure number is over 75, that increases your risk of having an aortic dissection. Check your blood pressure. If you have stage 1 blood pressure, your blood pressure is going to be roughly about 130 to 139/80 to 89. You have almost 2 times the risk of aortic dissection. Where you have stage 2 high blood pressure, you have nearly 6 times higher risk of getting an aortic dissection compared to someone with a normal blood pressure. And if you've ever had a systolic blood pressure above 180 in the last 5 years, you have a 56% chance of getting an aortic dissection, even if you are on high blood pressure medications. Now, being on high blood pressure medications is just not enough to reduce your risk. The thing is, most people don't take their medications regularly, or their medications are not enough to get their blood pressure under control and to be normal. So imagine one day you feel good enough to travel to work, maybe across the country to Ukraine, talk to your friends, and then within hours, the largest artery in your body, the aorta, begins to tear. That's what happened to one of my good friends more than a year ago, and he never woke up. Aortic emergencies have also affected well-known people, such as Lucille Ball, John Redder, and now Lindsey Graham. Now, in aortic dissection, it happens, again, when the blood somehow is tearing in the inner wall of the aorta, or the plaque ruptures through the aorta. It can become fatal very quickly, but people can survive when it is recognized early and treated in time. And by the way, if you find values in my videos, would you mind checking if you're subscribed? And if you are not subscribed, please hit the subscribe button, like button, and share button, because it does change how many people get to watch my videos. I appreciate your partnership in helping to change the world. Now, the most important warning sign is sudden severe chest pain that goes to your upper back, or an abdominal pain that reaches maximum intensity almost immediately. And some people describe it as a tearing or ripping or stabbing or crushing, or the worst pain in their entire life. And the pain, it actually may move, because if the dissection spreads down your aorta, the pain will move. So basically, your aorta is made out of 2 layers of tissue, and oftentimes the blood can travel between those 2 layers. It is a pretty long artery and spans from your chest wall to your groin. Now, other signs can include shortness of breath, sweating, fainting, confusion, weakness. Maybe it's just on one side, trouble speaking, visual changes, leg pain, or difficulty walking. Your one arm may feel colder or weaker than the other arm. And the pulse or blood pressure, it may differ between the 2 arms. If you think that's happening to you, call 911 immediately. Now, unfortunately, we can't always prevent every dissection. Now, some people do have a genetic condition, or they have abnormal heart valves that weaken the aortas. Others can have an aneurysm without even knowing it. However, many major risk factors, we can identify that early and treat that early to lower your risk. Now, the first step is to lower your blood pressure. The second step is to lower your blood pressure. The third step is to lower your blood pressure. You get my point? High blood pressure repeatedly pushes against the aortic wall, pounding that plaque in, or dissecting to the tissue planes is one of the strongest preventable risk factors. Don't rely on one good reading or numbers from years ago. Check your blood pressure at home several days a week. If you have to, check it every day and learn your true average. If medication has been prescribed for your blood pressure, take it consistently unless you work on your dietary habits and your movement to move circulation. And then your physician agrees to that change. And then don't stop your meds unless you really decide to commit to that lifestyle, because the lifestyle is causing your high blood pressure.
You point your camera app to this QR code. It'll take you to a link for a free handout that I created just for you.
Now, there are several ways to lower your blood pressure, and it 100% starts with your food. Now, the thing is, when you eat food, it's just not about lowering your blood pressure, but it is also about supporting your aorta to remodel and be strong and resilient. The aorta contains collagen, which gives it strength, elastin, and those allow it to be stretched and to be elastic. Food cannot repair an aneurysm, but your body needs nutrients to maintain that connective tissue to still make that wall strong. Vitamin C, it helps your body make collagen. And if you eat bell peppers, citrus, kiwis, berries, broccolis, tomatoes, and leafy greens, you'll get vitamin C. Copper also supports making collagen, as well as elastin, and is found in beans and lentils and nuts and seeds and mushrooms and whole grains. And of course, protein, that provides amino acids used to build connective tissue. But when you choose foods, it should do more than just one thing. Your protein should do more than just supply protein. So when you eat beans and lentils, soy foods and nuts and grains and seeds, it provides not only protein, but potassium and magnesium and fiber. They all support lowering your blood pressure and improving your cardiovascular health. So on your plate, if you eat a plate of lentils, brown rice, spinach, bell peppers, pumpkin seeds, that provides you the equipment to make collagen, and it supports the nutrients to help you remodel your heart and blood vessels and lower your blood pressure. Now, the thing is, many of these nutritious foods like beans may be hidden with a ton of sodium salt. And if it's prepackaged, it's going to contain a lot of sodium. And the problem with sodium is that wherever sodium goes, water flows. So if you want to lower your blood pressure, you have to regulate the amount of sodium that you are eating prepackaged, whether it's in bread or your favorite sauce. And it's really easy to stop eating a ton of sodium. You got to stop eating convenient food. Restaurant food, deli food, meat, cheeses, packaged soup, sauces, instant noodles, frozen meals, and salty snacks. If that's your diet, you're going to have to read labels, compare products, use herbs and spices and garlic and ginger and lemon to add flavor instead of wanting the salt. Now, if you want to add salt, then eat more potassium salt. It's a salt substitute, unless your doctor has told you to limit the potassium. Now, remember how I told you there's a couple types of aortic dissection, and the second type is caused by a plaque that erodes through the aortic wall? Did you know that we are all susceptible to getting that plaque, and we all have it? If you're a smoker, you have more plaque. And if you don't want to get plaque, that damages your wall and increases your chances of developing an aortic aneurysm, then number one, you got to stop smoking. It's regardless of how long you've been smoking, just stop today. And when it comes to drugs, your aorta is not forgiving. So, illicit drugs like cocaine and methamphetamines and stimulants, they're dangerous because they cause surges in your blood pressure and heart rate. And one great way to get your heart rate down is with movement and with breath work. But before you just randomly start moving, you should really check with your physician or cardiologist to make sure that you're not straining, because straining can cause sudden pressure spikes. So things like walking, cycling, swimming, or light to moderate strain training, they can be helpful. Avoid holding your breath when you weightlift. But anyone with an enlarged aorta or a previous dissection or an inherited aortic condition really should check with their cardiologist to know exactly what kind of exercise they need to do or that's safe to do. And don't forget that you need time to restore and repair. And that's the power of sleep. Sleep also helps to protect the aorta. It can help protect your metabolism. It can help allow remodeling and make sure that you don't have any untreated sleeping conditions. Now, you may be sleeping long enough, but If you're not sleeping well through the night, then you're not getting rested sleep. So make sure you don't have sleep apnea that causes repeat drops in oxygen and repeated surges in stress hormones throughout the night. Loud snoring, gasping, morning headaches or daytime sleepiness, or maybe even difficult to control blood pressure, sometimes is an indication that you're not sleeping well, that you may have sleep apnea. And if we diagnose you, we can fit you with the right mask to help you sleep at night. Now, remember how I mentioned that plaque is one of the major causes of aortic dissection. And that's why it's really important that we don't build more plaque. And besides stopping smoking, fixing sleep apnea, there are other ways to reduce your plaque. And if you want to learn how to best do that, watch the next video.